What's the coolest thing about robotic surgery?
Coolest thing I can say is the vision. That's an amazing vision. Every surgeon enjoys the ergonomics of it. So I can say that's the best part.
Can AI predict surgical complications in real time?
Yes, of course, AI will help us in guiding about various surgical steps. If we are going to create any issues, complications, it may be even a suturing, it may be even cutting a vessel, it may be cutting any thoracic surgeries, maybe a thymoma or a lung surgery, colorectal surgeries, gastrointestinal surgeries. All these surgeries eventually will be done much better way robotically. So difficult to choose one.
Patient you operated got discharged and comes back for a follow-up, walking into your OPD.
The first question I ask them is, how much is the pain? And they say, I have no pain. And I'm like on a moon that yes,
That's
is
like
the
music to your ears.
Yeah, that is the thing I wanted to listen. I have to listen to my sister, my colleagues, my assistants, my residents, my even Maushi's mama's anesthetist, because finally it is a team effort, and one robotic surgery you cannot do all alone. There is, so all surgeons know that if anything is there to help you in real time during the surgery is going on, it is really a boon. So robotics offer you that. So robotic surgery gives you clear-cut indication.
Robotic surgery has moved from being a futuristic idea to an integral part of modern operating rooms. It brings together precision, stability, and enhanced visualization to support better surgical outcomes. In today's episode, we explore what this technology actually offers, not in theory, but in day to day clinical practice. We will break down how surgeons use it, where it adds real value, and what its limitations are. Joining us is an expert who works with robotics systems regularly, sharing practical insights for patients and healthcare providers alike. Dr. Sanjay Kolte, a global expert in laparoscopic, bariatric, and robotic surgery at Sahyadri hospitals, trained across India, France, Austria, and Taiwan, and a member of the Royal College of Surgeons, Edinburgh. He is redefining precision surgery. A pioneer in robotic assisted procedures, Dr. Kolte transforms complex surgeries like hiatus hernia, all types of hernia surgeries, thyroid surgeries, gastrointestinal, biliary, pancreatic, colorectal, thoracic surgeries into faster, safer, and minimally invasive experience. Beyond the OR, he's passionate about fighting obesity, metabolic diseases, creating real impact nationwide. Get ready to explore the cutting edge of surgery and the future of robotics with Dr. Sanjay Kolte. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Sanjay Kolte. Hello, sir. How are you?
I'm good.
Welcome on Sahyadri Health Talks, and we are going to talk about robotics today. But before I do that, a big congratulations to the entire team and a leader like you, 100 plus surgeries in less than a year. How is the experience with the robotics?
Thank you so much for inviting me for this talk. And yes, robotics is my new love.
Yes.
And robotic surgery is being there for years. But yes, definitely I would rank it now like number one, which I'm interested in my future life.
Okay. Yeah. So how was this journey? Because you bring experience of 25 plus years, and you have literally seen surgery evolving, right? Be it in terms of technology, introduction of robotics. What do you feel? I mean, how was this journey? Tell us. I mean, take us through this.
See, I started my practice since in 2000, and since then, in over the last 25 years, I've observed surgical practice changing from open surgery to laparoscopy, laparoscopy to now robotics. And every time, if there is a new introduction to any of these latest modalities, there has been a apprehension, then probably there has been criticism. But whatever I have seen in last 25 years, this has everything what has gone through, like laparoscopy or robotic, it stood the test of time. And I can say, yes, robotic is here to change the entire scenario once again. And definitely learning robotic surgery was a bit tough, but then it was not so challenging because I knew laparoscopic surgery very well.
So it's more kind of a step up from the laparoscopic surgeries.
Yes.
So while robotics is something which even a layman knows now, but there were times in the initial when robotic surgeries were introduced and a lot of myths were there around it. And sure, pretty much, I mean, a lot of it prevails still now. So how difficult it was for you to, talk to the patient, address those apprehension, and make them understand that it's not a robo who is doing it, it's me who is doing it.
Good question, because these are the questions I keep facing in my clinic
Day-to-day
or in my
practice.
day-to-day practice.
Yes.
Very much true. See, whenever word robot is said, every patient remembers either a Bollywood movie,
Yeah.
or maybe Isaac Asimov's novel. So in such cases where robot is completely autonomous, he is performing the tasks which he has been taught, and then there is no human interaction or human interference, I can say. But here what happens is that robotic, when we use word in medical language or for medical surgeries, what the robot we use is a basically slave model. So here robot cannot function autonomously without my permission, without my interference or instruction, you can say. So if you can understand, there are three parts to robot.
Achha.
It is not exactly a robot which you can see in movies or in IPL, the dog moving there on the ground and everything. So what happens is this robot is basically has three parts. One is a multiple arms with instrumentation, which we fit onto the patient's body when we start with the surgery. Then there is a second part where we have a cart, where we have a vision cart, where we have systems, and the third is a console. So what console means is that where surgeon sits and he operates, or he gives instructions, or he works with his fingers and wants them to be replicated into the robotic arm. So it is me who's performing surgery. So if you have seen the some Marvel movies or something, Ethan is sitting in the transformer and then he is trying to box it. So it's not the transformer who does it, it's basically a surgeon who does it. Similar way, it is like mainly a slave model, not an autonomously doing surgeries. Maybe in future there will be something like that, that autonomous robots may come off, but it's up to the time will decide that.
Yeah, so I think it's more kind of it will take some time, because end of the day it's the matter of a life and death, and it's a human body that needs the attention. So I think we have time for that.
So see, if you ask me again, this is another tricky thing. AI is coming in a big way. So if you see, AI has come in WhatsApp, AI has come in everything, and every possible application is now associated with AI.
Correct.
So someday AI will come in. It's already there in our robotic surgery as well. So AI will try to interfere, or rather help us also in certain ways. So AI will definitely give us some clue, something to avoid complications. AI will help us have more precision, which is definitely helpful to a surgeon as a patient. But somewhere AI does not have an emotional angle, which a surgeon has. So that angle, because we cannot feed that angle into an AI and have some answer to that. So maybe AI will tell us, no, this you just go ahead with this step 2 in surgery, but a surgeon with an emotional aspect may or may not go for that. So that is how, that is where the future lies. That emotional aspect may not be changed during surgery. As you correctly said, this is finally a human life
that
we are
we are
dealing
dealing
with.
with, right? So what's that I mean, I'll put it this way, most funny or ridiculous thing people have asked you when it comes to robotic surgery?
Funny is that if you're putting a robot for a surgery, are you going to charge me for your fees, or is the robot going to charge the fees? Is the robot going to take the fees? So that is the funniest question I have heard. And ridiculous, I won't say, because ridiculous is not the right word maybe, but then ridiculous in the sense, can we do all surgeries including cesarean section, including baby delivery from robot? No, we can't do. Today's era, I can just say, whatever can be performed with laparoscopy can be performed robotically if the patient is fit for surgery.
Okay, so we also do have a fitness criteria which decides whether we can do robotics.
Yes.
So what would be some of the criterias in or the conditions in which we cannot do a robotic or cannot go ahead with the robotic?
All the cases where our laparoscopy is not possible, all those cases we cannot actually perform robotic surgery, because all these cases we inflate the abdomen with a gas. We make space available for us. In such cases, robotic surgery as well as laparoscopic surgery can be risky for the patient. So in such cases, we do not go for robotic surgery. We prefer to do a traditional open surgery. Otherwise, most of the cases, most of the surgeries can be done robotically. I have till now performed 35 different types of robotic surgeries, right from head, where we have done a tongue malignancy, where we have done thyroid surgeries, where we have done lung surgeries, I have done many of the colorectal, gastrointestinal, biliary surgeries. So all these surgeries can be performed robotically with ease. Yes, there is definitely a learning curve, but once you achieve your expertise, so maybe you can venture into more and more robotic surgeries. But that is, yes, we can always do all robotic surgeries possible for all the fit patients.
Okay, so are there any particular organs on which robotics cannot work?
Frankly speaking, there are no such organs, but yes, in my specialty, I can say superficial or surface surgeries, robotics have very limited role or no role, because these are aesthetic surgeries more or less, and these are the surgeries which cannot be performed robotically. Robot works mainly in the cavities. So where, like thoracic cavities, like any lung surgery, mediastinal tumor surgery, I've done thymomas, I've done surgeries for myasthenia gravis, I've done lung resections. So then abdominal surgeries where there is another cavity, where we have done hiatus hernias repair, pelvic surgeries where we have done colorectal or gynecological procedures. So robotics mainly work in surgeries where we have cavities.
Achha. So almost everywhere it can work, wherever a laparoscopic surgery can be done, robotics can be performed.
Yes. So we can call that completely as a minimally invasive surgery, laparoscopic as well as robotic. In future, if I see, robotic surgery will replace laparoscopic surgery to a larger extent.
Yes. So while we talk about the immense role that robotics plays when it comes to doing complex procedures, and from a layman's perspective, the most common thing which we have heard is reduced blood loss, minimal tissue damage is what we do. But what's beyond that? I mean, how robotics actually makes a complex procedure easier when it comes to a traditional approach versus robotics?
Exactly. So laparoscopic surgery also offers the same. Minimal blood loss, less pain, recovery faster. But then in robotic surgery, what happens is that you are actually controlling all the arms, including your camera. So you actually go to the target organ as close as possible.
Achha.
You can see everything, small blood vessels very clearly, because it's finally a stereoscopic image what we get on our Da Vinci robot in Sahyadri Hospital. So that precision is much better in robotic surgery. That 3D angle, that 3D vision is very interesting for a surgeon to. A surgeon enjoys that surgery, and dissection is far superior. It's par excellence. So all this is reflected in
The
patient's
outcome.
outcome. And recovery is really faster. The pain score is really low. So that automatically makes this robotic surgery superior to laparoscopic surgery for the same disease.
So maybe I will not be wrong to say this, that it's a boon for the surgeon first and eventually for the patient.
Yes, it eventually is a win-win position
Yeah.
or win-win situation for both
Yeah.
surgeon as well as the patient. That yes, surgeon get to do a surgery more precisely with a fantastic ergonomics.
Yeah.
See, and a supervision. And there are added advantages, including of the AI, which keeps patients safe as well. So it is win-win situation for both.
So when you say supervision and the satisfaction which comes on your face, I can actually imagine the clarity of vision which you have while doing this procedures.
Absolutely, it is more than that 4K vision. It is 3D vision. You can
Yeah.
see what is there behind the structure also.
Acha.
So you can just change your angle of the camera. You see what is there behind. Before cutting, you cut every millimeter by millimeter. You see if there is any blood vessel, anything else which you can damage. These are things which were not available in laparoscopy.
True.
In traditional surgery, we had all this because we used to operate with naked eyes. But then in traditional surgery, there used to be huge scar. There used to be pain. There used to be complications of the scar itself.
Yes.
Then, of course, there is a lot of pain related to retraction and everything, which is not required now. So it is completely very safe that way, and very I can say
comfortable for the patients.
Comfortable for the patients. And it is very easy to perform as well if you have mastered it.
Definitely, because I remember knowing people who had undergone gallstone surgery maybe 20 years back, and they had a good 5 centimeter cut on their stomach because it was an open surgery. And now it's hardly a pinhole, and not even that. I mean, there is no scar, absolutely no scar, no cuts.
Absolutely, means this is not only for gallbladder, it is there for hernia, it is there for colorectal surgeries, gastrointestinal surgeries, it is for even lung, where we used to open cut one rib, remove one part of the rib, and then go into the thorax to remove a lung or probably a small section of the lung. Here what happens, we take just 4 small stitches, fall pinholes, and through which we do this surgery. It is such a simple task to perform because of the excellent camera vision and ergonomically. See, traditional surgeries, we have 6 movements of our hand.
Acha.
But in robotic surgery, we get an additional 7th degree freedom.
Acha.
So that is very essential because your suturing becomes extremely easy, faster, and to the perfect. So it is really robotics have taken the surgery to definitely a higher level.
So while we talk about robotics, we talk about AI. There's also something which is machine learning, where over a period of time, the machine starts giving you real-time instructions with regards to the depth and other stuff. So you as a surgeon, how do you validate this in real time, and how difficult it is for you to manage this?
Some of the companies have integrated, there are few systems which are used by using AI. So something like to identify blood vessels, identifying ureters, identifying the ducts, everything. So using the dye, using another stapling or suturing technique, using something like CT scans which are integrated in your system. So all this helps you in real time to understand the anatomy.
Acha.
You understand the anatomy of the disease. See, every patient with the same disease is a different thing.
Hmm.
Because even if you operated say 1,000 gallbladders laparoscopically, the next gallbladder can be still a bit different, difficult, and it may be another pleasant or bad experience for you. So all surgeons know that if anything is there to help you in real time during the surgery is going on, it is really a boon. So robotics offer you that. So robotic surgery gives you clear-cut indication where the duct is, where the blood vessel is, where you have to stop, where is the clear margin for cancers, that cancer is over now. So all these real-time things are very important for the surgery.
So we have multiple robotic tools currently. To name a few, it's hepatic feedback, 3D visualization, AI guided suturing. So what are these and which one is more promising? What are your thoughts?
Haptic feedback is one thing which is rather like a disadvantage in robotic surgery.
Achha.
Means what is that haptic feedback means if I am touching this mic, then I know there is a feedback given to me.
Achha.
Yes, I have touched, I have reached that place and I have touched it.
Achha.
In laparoscopy, you can hear that some tone, noise, you can hear something. In robotic, you do not realize
Achha.
that there is a that you have already touched the tissue. Achha. But then automatically over a period of time, you start understanding by this 3D vision, by this AI integration, that yes, you have already reached that organ and you have already handling it, you're already grasping it too tight or too gentle. So all these things come with a experience. So you can overcome this haptic feedback with this 3D visualization as well as with AI integration. Suturing, yes, we some of the robots, the way we have in Da Vinci and Sahyadri, has a stapling suturing technique. Achha. So we have staplers which we use, and the AI integrated these staplers, they automatically seal that maybe bowel, maybe blood vessel in such a smooth way and in a complete way that there is hardly any possibility of a leak from there. Achha. So this AI integration into staplers is really last few years, I can say, definite invention which has helped us surgeons as well as patients.
So when it comes to robots performing semi-autonomous tasks in high, in some surgeries, how close are we to that?
Autonomy in robotic surgery has been divided into say like 5 grades. The 0 grade is where it's like traditional surgery, everything is done by surgeon.
By the surgeon and surgeon's
Robot
experience.
doesn't do anything. So that is one thing. And level 5 autonomy is where the surgeon is completely taken off and its entire things are performed by a robot. So we are going through those stages. Recently, last couple of months back, there was a complete autonomic surgery performed on a, I think, pig with a gallbladder surgery, and that was completely done without even a human interference.
Achha.
I do not know. There will be some legal implications to it. There will be some aspects, emotional aspects, as I already mentioned. So all these things will come. Because finally, whatever we fed to AI, the AI will respond to that way. So we'll have to see what happens next.
So that brings me to the next question, which is, do we have any risk factors here?
As I already mentioned, haptic feedback, there is no feedback, you have to learn it. You have to understand how much compression you are giving, whether it is too low or too high. That is one thing. Second, you are so close to the target organ that if anything else is happening in the rest of the abdomen, you do not realize. Third thing, you are finally dependent on a machine. So you have to really be master of troubleshooting, because you want to keep your patient safe. That's the most topmost priority. So you have to learn troubleshooting during these surgeries.
So when it
and of course, finally, cost.
Yeah, the cost is the
another issue.
So when it comes to the real time, machine learning, which we talk about, How does it actually happen? I mean, it happens from surgery to surgery. Every surgery is a new real time feedback which goes to the robo, and there's a machine learning which is happening. So how does it makes the how does it make the entire system better?
The surgery in the initial period, maybe when you are learning robotic surgery, maybe um, it may consume a lot of time. But once it is the system is established, once the team is very well trained, so you can start reducing the time required for surgery. It automatically reflects in your recovery and less hospital stay. It automatically takes your hospital to a higher level as well, because you are offering the state of art surgery to your patients. I can say that.
So, what is that upcoming, advancement which is coming when it comes to robotics, and you are really excited about it?
This integration of AI.
Acha.
See, even if so, we are still clueless about how the AI is going to be beneficial, helpful, or maybe even harmful. But we'll have to see. But whatever I have seen, whatever is somewhat integration done in the robot, I'm really happy that yes, AI will definitely help us in giving a best result to the patients. So integration of AI in various ways, including anatomical pictures, including analyzing the data, the patient scans, and then telling us that this is the plane I have to dissect, this is the where I have to stop, this is how I have to put my sutures, everything. So I'm looking forward to that, and hopefully in next 5-6 years we should be able to do that. There are very less companies, say I can say 10 years back, maybe 3-4 companies which started with robotic surgery. Today there are 100 robotic surgery companies are in the pipeline waiting for the approval. So robotic surgery is going to be the leader in surgery in future life.
So, as you were saying during the initial part of this podcast, that robotics have come recent in the picture, and while what was taught in the medical school, I mean, now they might add robotics to their curriculum, but back then it was not added. So, what message do you have to all those budding surgeons who really want to, get their hands on robotics and do this? So what message do you have for them?
We have our postgraduate students here at even Sahyadri Hospital, and I can see that all these gadgets are very they are very tech savvy people. So it's easy for them to learn these surgeries. Of course, they cannot ignore learning traditional surgeries, because finally traditional surgery, oral laparoscopic surgery, is going to be a bailout procedure for anything happening in robotic surgery. But yes, when saying that, they have to learn robotic surgery, because 5 years, 10 years down the line, every surgery in every corner of India will be probably offered a robotic surgery first. In 2010, I remember there were hardly 3 or 4 installations of robot all over India. It's 2025 and we have 300 plus already installed, and more than that, they are already in the pipeline to be installed in various hospitals. So if you do not know robotic surgery, it's not going to help you in your future practice. And robotic, I can say, see, in open surgery, they never used to see the anatomy so well because of too many assistants, heads of the surgeons coming in. Robotic surgery, you see everything so clearly and precisely that they learn anatomy very well. And that is going to be helpful in them in their own practice as well as while learning surgery.
Yeah. So it's a boon.
It's a boon for them.
And do you personally feel that every established, establishment or a hospital should have invested in robotics?
Yeah, finally, this is going to be a game changer.
If you don't do that, then
if you don't that, you will start lagging behind. People are opting for robotic surgery now.
So people do come and ask you.
Yes, of course. they come and ask us about robotic surgery. Can we do a robotic surgery for me?
Okay.
So earlier, say 2 years, 3 years back time, people used to ask for laparoscopic surgery. But now, since last 5 years or I'm seeing people are inquisitive about robotic surgery. They keep asking whether it is possible for me. The way I told you that it was a ridiculous question, that whether the delivery can be done robotically. No, you can't take the baby out after using a robot. But then that is how people are coming and they are asking for robotic surgery. So 5 years down the line, every surgery will be there. They'll be asking robotic surgery.
So that was about the broad discussion which we had on robotics, which is still not sufficient, but we don't have time much. So I'll quickly move to the next segment, which is I'll ask you a few questions, and maybe to summarize the entire discussion which we did, we can have these questions, and you can just give us a crisp answers for
Yes.
Okay, let's get started. Is robotic surgery okay for all the surgeries and all age groups?
Yes, Sushita, as I already told you that probably yes, all laparoscopic surgeries which we do today will be done robotically in due course of time. And all age groups, yes, it is really safe for a young adult, safe for even geriatric people or old people, but if they are medically fit. But yes, pediatric, it is still under maybe you can say developing field yet.
Yes. So fitness is the main decision factor.
Yeah.
What surgeries benefits most from robotics today?
All the cavity surgeries where a human cannot reach, or his hand, even if his hand reaches, he cannot see or visualize. So all thoracic cases, all cases near hiatus or diaphragm, all pelvic or abdominal surgeries.
Sure. Which organ is the hardest to operate robotically?
Tough one, but then yes, we can say pancreatic surgeries are a bit hard, where we are dealing with pancreatic cancers. So they have very long hours to work, even if we do open or laparoscopy. So robotic will be still challenged doing that. Yes, people are doing it. We have done it. So that's the hardest one to remove.
Okay. Can AI predict surgical complications in real time?
Yes, of course, AI will help us in guiding about various surgical steps. If we are going to create any issues, complications, it may be even a suturing, it may be even cutting a vessel, it may be cutting any other organ. So, of course, AI will help us in avoiding complications in
and
future
I think
time.
it is the entire essence of robotics, right? That it stops you from, getting into complications or something like that.
Yes.
Okay. What's the coolest thing about robotic surgery?
Coolest thing I can say is the vision. That's an amazing vision. Every surgeon enjoys. Every surgeon enjoys the ergonomics of it. So I can say that's the best part of
I've
it.
heard so much about this vision thing during this entire podcast. I really feel like joining in one of the surgeries
I would
just to have a
definitely.
look at it. That kya dikhta kya hai? ऐसे that
So it
feels
is
so
a 3D
nice.
vision where you put your head into a stereoscopic vision, and that creates such an angle, and it is amazing to watch those colors, those tissues, which you have seen with open eyes, but then with robotics it is an amazing thing completely. I would definitely ask you to please join me sometime, someday in a surgery, and
I will be joining in the OT
see
very soon.
robotic.
How small can an incision get with the robotic surgery today?
These are the incisions same as laparoscopic surgery. So there will be some of them will be 8 millimeters, some of them will be 10 millimeter, but same as laparoscopic surgery. But definitely much smaller than what we have in traditional surgeries.
Approaches. How do you handle patient skepticism about robotic surgeries?
Yes, you need to have a good counseling session to them with them, starting from why am I offering a robotic surgery, or why they want a robotic surgery. You need to understand their understanding about really what they want. Do they expect anything, something like a miraculous thing is going to happen? No, but yes, they. I need to. I actually tell them that the recovery and everything, they will definitely be happier if they go for a robotic surgery.
What's one medical procedure that could be completely transformed by robotics in the next decade?
It may not be one procedure, but it may be various procedures, including, say, like thyroid surgery, complex hernia surgeries, thoracic surgeries, maybe a thymoma or a lung surgery, colorectal surgeries, gastrointestinal surgeries. All these surgeries eventually will be done much better way robotically. So difficult to choose one, but then if you still ask me to choose one, I would say maybe a thyroid surgery.
Which really shows very promising results. Okay, that's about that. And before we let you go, we would want to hear some challenging case or some story from a patient's journey, recovery, which has been really close to your heart and has shown great success.
There was I've gone through many cases where I've seen a lot of challenges, lot of expectations right from beginning. But there is one case which is close to my heart. Is one lady with say 125 kg plus weight, and she had a huge thyroid enlargement which was compressing on her trachea. Because of obesity, she was not breathing well. She used to find difficulties in breathing. Then she had a huge thyroid, and the endocrinologist asked me to remove that thyroid. So I earlier thought that probably an open surgery would be an easy task to do it. But then I realized that her neck was very short and very small. So in such cases, it is really difficult to perform even an open surgery. Then I thought of this robotic surgery, in which we do actually, there is no incision over the neck. All the robotic arms or instruments, they come through either axilla or through the chest.
Okay, so absolutely
So there is
nothing
no
here.
absolute scar here. And then it was easier because we did not need that much of neck extension. We could do that easily. It was like an open surgery but using robot. And then it was a very successful, though we took around 3 to 4 hours, but then it was a very successful, satisfying moment for us when we finally finished the case. Next day she was ambulating, everything was well. Third day she was discharged. So that was an amazing thing for me to really see that yes, robotic surgeries can be offered to such difficult cases as well.
So what has been the longest time you have spent in OT?
Maybe I can say 14 to 16 hours in doing a robotic esophagus cancer surgery. Then there were some cases of colorectal cancers where we took a long time. So these are the cancer cases generally take a long time because you have to adjust robot at times. So that also takes some time.
Okay. So do you still remember your first robotic surgery that you did?
Yes, very much.
How was the feeling?
I was tense. It was, my heartbeats were.
You could feel it?
I could feel it. There were palpitations because the patient was 80 years, a doctor's mother, and then they had come for robotic surgery, and it was my first surgery. But I could somehow gather my confidence, courage, and then we went ahead, and it was a fantastic surgery. I just enjoyed. The doctor was present in the operation theater. He also was so happy to see that there was a lot of difference between laparoscopy and robotic. And then of course the result, next day she was home. So that was one tough surgery, but it was a memorable one.
So did you sleep well after doing that?
Of course. But I can definitely tell you, a day prior or a night prior to a robotic surgery, we surgeons keep thinking a lot about how do we approach it.
Okay. So do you still get that excitement every time when you do a robotic surgery?
Absolutely. I'm too excited to do a robotic surgery. Whenever I'm planned, I'm looking forward to that surgery. Oh yes, I'm going to do this surgery robotically. So I keep telling myself that yes, this is the day, now you are going to perform one more robotic surgery,
One more added to
and
the kitty.
one more additional,
And one more
and
happy smile coming
yeah,
after that.
only thing comes when I'm doing that robotic surgery for the first time.
Uh-huh.
Though I have done those cases laparoscopically or traditionally n number of times, but when you are going to do it with robotically, then you keep feeling that anxiety, a bit of you take some time to settle down. And I'm sure this is all the way we see all sportsmen also. It's not easy to perform in every cricket pitch the same way they must have performed somewhere else.
So how
It
does
is
it
something
feel?
like that.
How does it feel when you see that the patient you operated got discharged and comes back for a follow-up, walking into your OPD? How is
The
feeling?
first question I ask them is, how much is the pain? And they say, I have no pain. And I'm like on a moon, that yes,
That's like music to your ears.
yeah, that is the thing I wanted to listen. I wanted always my patients to have that recovery. I
The whole
wanted to
point of doing
exactly. So see, technology is there
it.
to be for you to use it. One should not misuse it. And I always used to earlier think that yes, probably I'm misusing or I'm using, I don't know. But when I started realizing these patients feedbacks, getting them saying that yes, this is something which really I never thought, but the result is ultimate. And it's really I've started working also so fast. There's no pain. So then I have realized, yes, somewhere I am on my right
On the
track.
right track. So is there any pre-surgery ritual that you follow?
Superstition you want to ask?
Anything superstition or a belief or maybe a habit that you have?
Nothing such habit or superstitious thing. I can say all surgeons are superstitious. They will do something which the patient has benefited last time. So maybe something like that. They
So
keep
you have
doing
something
it.
like that?
So yes, there are certain. I would not like to say it to the patients, but yes, there are always superstitions the surgeons follow. And that's completely
Fine. Up to one's
fine
belief.
because it's finally for the benefit of the patient.
That's great, and it was wonderful talking to you. Do you have any final message for all our viewers, all the patients out there who might be still a little apprehensive
Yeah.
about robotics? What message do you have for them?
I can still not exactly message, but I can request or ask patients if they have any disease or anything, they can seriously ask their doctor, treating doctor, if the surgery is robotically possible. But rather than just asking their own doctor, ask and go to a robotic surgeon to ask them whether it is really possible to go this and do this surgery robotically. Will I have a good outcome? Everything. So do consider robotic also as one modality of treatment whenever you are considering a laparoscopic surgery as a modality.
So how do you wind up after a long tiring day? Because you spend most of your time in OTs and OPDs. So how do you keep yourself?
Personally speaking, we all have habits. I also do have habits. I prefer to do yoga before surgery, after surgery. I prefer to listen to music during the surgery because that keeps my mind calm and cool. So there is constant some music going on in the operation theater. I keep talking to people. Everyone in my theater has a right to say whatever comes to their mind. No sir, this is not the way, because it's finally robotic surgery is a team effort. I have to listen to my sister, my colleagues, my assistants, my residents, my even she is mama's anesthetist, because finally it is a team effort. And one robotic surgery you cannot do all alone. There has to be another surgeon sitting at the console. There is surgeon sitting at the patient's bed. The anesthetist is monitoring every position and everything. Sister is there to just undock the instruments. Your resident doctor is doing some help to you to clip the things. So it is really important for a surgeon to understand this is team effort. It is
Mm.
not me who is doing robotic surgery. It is the entire team who is doing robotic surgery.
Mhm.
And to keep their moral high,
Mm.
I need to keep talking to them and asking them if I am doing right or I am doing wrong, because I am seeing the vision 10 times magnified. They are seeing probably in the real time, or maybe a smaller than what me I see. So they may pick up the things faster or quicker than me. Sometimes that is possibility. So I keep talking to them. So that is how I try to keep a very light environment in my operation theater, and that keeps stress away.
So it was lovely having you on this podcast, sir. And we spoke so much about robotics, and I think it was much required considering the kind of advancements that are happening in the fields of surgery. So thank you for giving us this time. And
Thank you so much, Tushita, for inviting me for this podcast, and I really enjoyed. And I hope some of the information which I shared with the audience probably will help them in taking decisions, right decisions for robotic surgery. And thank you so much for it. Was pleasure being here.
thank
Thank you
you,
so
sir.
much.
And I'm sure many of our viewers will have a lot of information for when it comes to robotics, of course. And on that note, this is Dr. Tushita signing off, Sahyadri Health Talks.